But there is always a depiction that people suffering making surgeons means that they end up planning in surgeries. Is that really so? This is Dr. Arun Reddy, consultant neurosurgeon and endoscopic spine surgeon at Care Hospitals, Kachibodi. The matter of fact is, no. Not all the patients that walk into our OPDs, they'll end up in surgeries. 95 to 98% of the patients who walk into us, we treat them with conservation, with medicines and physiotherapy. And the most important thing is precautionary aspects are taught to them, which will take off their neck pain or back pain. That's what we need to understand. And it's a very less spectrum of people whom we suggest sequentially. Once all the medical treatment, physiotherapy precautions are exhausted, that they'll end up in surgery. And in a very rare occasions, probably first timers who will end up into our COPDs, that we suggest surgeries who are in intractable pain or who have deficits in form of weakness or numbness or tingling or bowel and bladder disturbances, that for whom we do suggest on the first meeting itself. But believe me, spine surgeries are safe. We have got multiple gadgets which are augmented into our procedures, which end in smoother and healthy as well as early recovery of the patients. So let me talk about different modalities of surgeries, which where the patients right now they ask about minimal cuts, minimal surgeries. Okay, so initially there was an era wherein we used to take a longer incision, expose the entire spine, which used to take it all on our muscles which are there adjacent to the spine, and put in screws whenever it is required, or in a case of an disc related issues, remove the disc. From that era, we have come to an era wherein we landed up into a much lesser incision, and with the use of microscope we started opening, and later on it followed by MIS, that is minimally invasive spine surgery, wherein it is of again two spectrums. One is a tubular system wherein we talk in tubes into from the skin near our spine, and probably the incision would be around a centimeter to centimeter and a half, and operate through those smaller incisions, and which can be extended to fixations to whenever it is required. This helps in airway recovery where the muscle injury is very less due to the surgery, and the patient are made to walk probably on the same day or the next day. Next came the advent of fully endoscopic spine surgeries, which are stitchless. That's what I call. We don't put sutures. Few case scenarios, we do it under local anesthesia. That means that we would be talking to our patients when we are operating on them, and the patients themselves are our real feedback during the surgery. They say at a moment of time that, "Sir, my back pain is lost, my leg pain is which was there pre surgery." That is wherein the pathology that and this which was causing a problem would have been removed. So that marks the end of the surgery, and patient themselves give us a real feedback during the surgery. So this is how the era of the spine surgery has evolved, and it is really safe, and patient get ambulated on the same day itself, or definitely as on the next day, and made to send back home within 24 to 48 hours. So any doctor who suggests surgery probably could be done in the best interest of the patient, and they have to get it done to prevent further issues to that. Thank you everyone for the patient care.